Hello friends, welcome back to Complete Medical Coding. Today let's learn few practice questions from the ophthalmology section. Okay, so friends, if you are new to the channel, please subscribe and please support me by liking and sharing this video. So let's move to the questions one by one. Let's move to the first question. A 2-year-old Hispanic male has a chalazion on both upper and lower lid of the right eye. He was placed under general anesthesia. With a 11-number blade, the chalazion was incised and a small curette was then used to retrieve any granulomatous material on both the lids. What code should be used for this procedure? Okay, so here, what procedure is being done? The patient was having chalazion on both upper and lower lid of the right eye. So it's unilateral, right? Only on the right eye, both upper and lower eyelid, the patient is having chalazion. And he was placed under general anesthesia. So under general anesthesia, the procedure has been done. Okay, retrieve any granulomatous material. So let's move to the codes one by one. What are the codes here? Starting 67800. Okay, 67800, 67801, 67805 and 67808. So these are the 4 CPT codes mentioned here. So just open the CPT code book and move to the code 67800. Excision. Excision of chalazion is a procedure, right? But what is the code 67800? Excision of chalazion single. This is not single. This is both upper and lower eyelid. Both the lids. Okay. So 67800 is wrong. What is 67801? Excision of chalazion multiple same lid. This is not same lid. This is different lid. Upper and lower. If in the question it is mentioned chalazion on both upper eyelid of both the eyes. In that case, you can mark this one 67801. Upper eyelid on both the eyes or lower eyelid on both the eyes. It means same eyelid but different eyes. Okay, multiple. But here it's upper and lower lid of the right eye. 67805. Excision of chalazion multiple different lids. It means for both the eyes and different eyelid. In that case, you can code this. Now, excision of chalazion under general anesthesia requiring hospitalization single or multiple. So, this is the correct answer. 67808 is the correct code because the patient was placed under general anesthesia and it's mentioned either single or multiple. So, the correct answer is option D, 67808. Okay, excision of chalazion single or multiple in patient requiring general anesthesia. Okay. Now moving on to the second question. An extracapsular cataract removal is performed on the right eye by manually using an iris expansion device to expand the pupil. A phacoemulsification unit was used to remove the nucleus and irrigation and aspiration was used to remove the residual cortex, allowing the insertion of the intraocular lens. What code should be used for this procedure? So, which are the procedures done here? Extra cataract removal was performed and insertion of intraocular lens. Okay, using iris expansion device. So, let's go to the CPT codes one by one. Here it is starting 66982, 982, 983, 984 and 985. Let's look into each and every codes one by one. The first CPT code 66982. These all are intraocular lens procedures. All comes under intraocular lens procedures. Okay. So, what is 66982? Extracapsular cataract removal with insertion of intraocular lens prosthesis. Yes, we need that procedure. Manual or mechanical technique, complex, requiring devices or techniques not generally used in routine cataract surgery. What is 66983? Intracapsular cataract extraction with insertion of intraocular lens. No, this is not intraocular cataract extraction. This is extracapsular cataract extraction. Okay, not intracapsular. So 66983 is wrong. What is 66984? Again, extracapsular cataract removal with insertion of intraocular lens processes, manual or mechanical technique. Let's see. What is 66985? Insertion of intraocular lens prosthesis. Only insertion of intraocular lens is mentioned in 66985. Extracapsular cataract removal is not mentioned in 66985. So that's also wrong. So the answer should be either 66982 or 66984. So from that you have to read each and every word, whatever is mentioned in the bracket also. Then you will come to know the correct answer, the exact answer. Okay. See, in 66984, if you can check below the description, it's mentioned in the bracket, for complex extracapsular cataract removal, use 66982. For complex extracapsular cataract removal. So just go to 66982. How we know if it is, if in the question, whether it is complex or simple? So if you can check in the code 66982, see, extracapsular cataract removal with insertion of intraocular lens prosthesis, one stage procedure, manual or mechanical technique, example irrigation and aspiration or phacoemulsification. Yes, this is mentioned. But the same is mentioned in 66984 also. Complex, requiring devices or techniques not generally used in routine cataract surgery. See the bracket example, iris expansion device, suture support for intraocular lens or primary posterior capsuloresis. Either of this should be mentioned in the question. So iris expansion device is there in the question, right? That's what you have. That's why you have to read each and everything, even though if it is mentioned in the bracket. Whatever is mentioned in the bracket is most important. Okay. So iris expansion device, here in the question it's written there, manually using an iris expansion device to expand the pupil. So our correct answer is option C, 66982. Okay, this is how you need to find the codes. You need to compare the codes. Now let's move to the third question. An entropion repair is performed on the left lower eyelid, in which undermining was performed with scissors of the inferior lid and inferior temporal region. Deep sutures were used to separate the eyelid margin outwardly, along with stripping the lateral tarsus to provide firm approximation of the lower lid to the globe. What is the correct CPT code? So here entropion repair is the procedure, okay, which is performed on left lower eyelid. Only left lower eyelid is mentioned. See, in the options it's mentioned the modifiers, right, from E1 to E4. So first you have to identify what is the modifier for left lower eyelid. Okay, the modifier E1 represents upper left eyelid, left upper eyelid. Okay, left upper eyelid. Modifier E2 represents left lower eyelid, which is what we need. Modifier E3 represents right upper eyelid, and modifier E4 represents right lower eyelid. So here we need left lower eyelid, which is modifier E2, which is there in options B and C, 67921 and 924. So if you want, you can check the other codes also, 67914 and 67917. But if you open the code 67914, it's repair of ectropion. 914 and 917, both are repair of ectropion. We need entropion repair, right? It is there in option 67921 and 924. From that, you have to find out which is the answer. What is 67921? Repair of entropion, suture. What is 67924? Repair of entropion, extensive. Example, tarsal strip or capsulopalpebral fascia repairs operation. Tarsal strip. So this is extensive. Because in the third, fourth line, you can see, deep sutures were used to separate the eyelid margin outwardly along with stripping the lateral tarsus. So tarsal strip is mentioned there. So this is extensive procedure. So our answer is option B, 67924 with modifier E2. Okay. Now moving on to the fourth question. After multiple orbital operations. Fibrous adhesions formed between the extraocular muscle and the orbital contents on the walls of the orbital cavity itself. The surgeon releases extensive scar tissue without detaching the extraocular muscle. What CPT codes are reported for the procedure? Okay, so here what is the procedure? Extensive scar tissue, releasing of extensive scar tissue. That is the procedure done here. So let's move to the options one by one. What is option A? 67318. 67318 represents strabismus surgery, any procedure, superior oblique muscle. This is not surgery. This is the release of extensive scar. So this is not strabismus surgery. Okay. Option B 67311 and 67331. What is 67311? Again, strabismus surgery, recession or resection procedure, horizontal muscle. No, this is not strabismus. What is option C? 67343. 67343 represents release of extensive scar tissue without detaching extraocular muscle. Yes, 67343. This is what is exactly mentioned in the question. Releasing of extensive scar tissue without detaching the extraocular muscle. Okay. And what is in option D? The same code 67343 along with 67332. What is 67332? Strabismus surgery on patient with scarring of extraocular muscles. No, you should not, you don't have to code this one because there is nothing mentioned in the question about the surgery, about the strabismus surgery. So you have to code only 67343. So the correct answer is option C, 67343. That is the exact CPT code. Okay. Now let's move to fifth question. A patient with bilateral upper eyelid ptosis and bilateral upper eyelid blepharochalasis arrives for upper eyelid ptosis repair via external approach using the levator aponeurosis application technique. Both eyes and upper eyelid blepharoplasties, both eyes. So here from the first sentence itself, what is the procedure done here that you will be getting? Okay, bilateral upper eyelid ptosis repair and bilateral upper eyelid blepharoplasties. Both are upper eyelid only. Okay. The upper eyelids were injected with approximately 3 cc each of a half mixture of cylocaine 2% with epinephrine and marcaine 0.5% with epinephrine. So now it is explaining how the procedure is being carried out. All the stories are mentioned here. The physician then cut along the pre-marked lines and excised a skin or muscle flap. The orbital septum was identified and opened, and any herniating orbital fat was removed. The levator aponeurosis was identified and 2 horizontal mattress 6-0 silk sutures were placed through the mid-upper tarsus and the levator aponeurosis. The patient was sat upright to elevate the lid height and contour. The patient was then repositioned and a reapproximation of the skin and orbicularis was accomplished using interrupted 6-0 silk sutures bilaterally. What CPT codes are reported? Okay. So here, since there are many CPT codes, if you can find from the options given, it's better to find the exact code. No need to look after each and every codes. Okay. So since it's written bilateral upper eyelid, so it means left upper eyelid as well as right upper eyelid, right? So here these two only upper eyelid procedures have been done. So it means modifiers will be E1 and E. E1 represents left upper eyelid and E3 represents left lower eyelid. And what are the procedures carried out here? One is upper eyelid ptosis repair, and other one is blepharoplasties. Okay, so what is the given code 67904? 67904. If you can check the 6 codes, only 3 codes are mentioned: 67904, 67901, and 67903 in the options given. So just go through all 3 options, all 3 codes. What is 67901? Repair of blepharoptosis. Frontalis muscle technique with suture or other material. 67903 represents repair of blepharoptosis, tarso-levator resection of advancement, internal approach. And 67904 represents repair of blepharoptosis, tarso-levator resection or advancement, external approach. So this is tarso-levator resection, which is mentioned in the first sentence. The third line, levator aponeurosis technique. But is it an internal approach or external approach? External approach is mentioned in the second line. See, upper eyelid ptosis repair via external approach using levator aponeurosis technique. So it is clearly mentioned in CPT code 67904. Repair of blepharoptosis, tarso-levator resection or advancement, external approach. So you have to use the code 67904 for both upper eyelid. Both upper eyelid means left upper eyelid and right upper eyelid. So you have to mark modifiers along with 67904, E1 and E3. Okay, 67904 with modifiers E1 and E3 is the correct code for this blepharoptosis technique. Okay, so blepharoptosis procedure is marked as 67904 with modifier E1 and 67904 with modifier E3. Now one more procedure is carried out, that is blepharoplasty of both eyes. So you have to check the other codes mentioned here, 15822 and 15823. What is 15822? Blepharoplasty upper eyelid, and 15823 blepharoplasty with excessive skin weighting down lid. Okay, so excessive skin weighting down lid. Is there anything mentioned like that in the question? Let's find out. So if you can check, this is a little confusing with options A and D, because 67904 is present in both options A and D with modifiers E1 and E3. Now you have to find out if the blepharoplasty code is 15822 as in option A or 15823 as in option D. Anyway, modifiers are correct, E1 and E3. So what is in 15822? Blepharoplasty upper eyelid, which is correct. But what is 15823? Blepharoplasty upper eyelid with excessive skin weighting down lid. Is there anything like that mentioned in the question? Yes, it is. See, in the almost third sentence, the physician then cut along the pre-marked lines and excised a skin or muscle flap. So it means the physician has cut those marked lines and then excised the skin flap. The skin flap is excised. It means that is an excessive or extra skin which was present, that was excised. So it means that is which is mentioned in CPT code 15823, excessive skin weighting down lid. See, blepharoplasty upper eyelid with excessive skin weighting down lid. So this is what is excessive skin has been excised. Okay. So you have to quote answer. You have to quote for the blepharoplasty as 15823 with modifiers E1 and E2. So what will be the correct answer? Option D, 67904 with modifiers E1 and E3, and then 15823 with modifiers E1 and E3. Okay, 15823 we have quoted because that represents blepharoplasty upper eyelid with excessive skin which was removed by the physician as mentioned in the third sentence. Okay. So friends, hope you had learned few procedures, few methods how to find the correct answer, the best answer from the options given. Okay, so if you find this video useful, please like and share, and if you are new to the channel, please support me by subscribing to the channel, and let's come back with more and more questions in the upcoming episodes. So stay tuned for more videos. Thank you so much. Bye.